Okay, my screen is visible and this is audible.
Yes, ma'am.
Yeah, ma'am.
Okay, Hariom everyone. So now today we'll start with next gastrointestinal disorder, that is our peptic ulcer. Okay, peptic ulcer, or it is also called as acid peptic disease, and in short form, like a CAD we used to call, in this we used to call it APD, acid peptic disorders. What is the full form of CAD? Who will tell?
Yes, ma'am.
Chronic artery
What is the
disease.
full form of CAD?
CAD na
Yes,
coronary
Coronary
artery disease.
it is caused by.
It is caused by
atherosclerosis.
yes.
Yes. Okay. So what is the topic in our syllabus which is related to all this? Because this is not the topic of our syllabus, that atherosclerosis, CAD,
Asthma.
asthma. Asthma is cardiac disease or respiratory disorder?
No, no, ma'am.
There are two types.
All cardio.
What? Name the disease which is related to all this, which is actually
Angina
in their
pectoris.
syllabus.
Angina pectoris.
Bronchitis asthma.
Yes,
Okay, yeah,
angina
yeah.
pectoris. What is angina pectoris?
Ma'am, angina pectoris is the disease means blood the blood stop flow the blood in the coronary artery way.
Chest pain,
What
ma'am.
is
Yes.
yes, this is a medical term for chest pain.
Okay, ma'am.
Okay, so now we'll then go afterwards for this. Okay, so peptic ulcers or acid peptic disease. Okay, APD. Now, definition for peptic ulcers. What are the peptic ulcers? Defined as the GI tract, because it is a gastrointestinal disorder we are seeing. So, problem at the level of GI tract will happen. So, it defects in the GI mucosal that extend through the muscularis mucosa. That means inner mucosal membranes are getting some lesions. We'll see that what exactly it is, or some problem at that level. Then it is caused as at the mucosal layer. It is called as peptic ulcers. Like this, you can see a little structure or a diagrammatic view of peptic ulcers. Like this, it is happening like a lesion. Now we can see peptic ulcer are the open sores. Open sores. What is a sore? Sore is a broken patch of the. Yes, ma'am.
And mucosa means it's like a fat uh, depo- deposit.
Since first class allergic rhinitis, I am telling about the mucosal
Mucus,
layer.
ma'am. Mucus.
Yes, mucus is something that jelly-like structure, but mucosal layer is everywhere in our body. The inner layer of any organ, innermost layer of the any organ is called as mucosal layer. Okay, mucosal membrane also we used to call it. Okay, like this, it is structure like this. Normal it is, but this sore-like structure, this lesion-like structure is made. This is called as this is this diagrammatic view of peptic ulcer. So what happens in this open source are there? Two things are there. Open source, what is source? Broken patch of a skin, a little broken part of the skin, or lesions could be there. What is lesion? Any abnormal or damaged tissues that caused by the any injury, any disease, any infection. Okay, if any damage to the tissues is caused by any of these injuries, infection, or disease, it is called as lesion. Okay, so this is peptic ulcer leads by open sores and lesions or damaged tissues. Okay, that develops in the lining of the stomach. That lining itself is a mucosal layer, small intestine, or sometimes in the lower part of the esophagus. It could go in the three parts. Okay, can develop in the stomach, inside the stomach, in lower part of the esophagus. What is esophagus? Also called as.
Food
GI
pipe.
tract. Food pipe. Yes.
Yes, yes, food pipe. And what is other name of the windpipe?
Trachea.
Tract.
Trachea.
What? Yes.
Trachea.
Okay, very good. Yes. Okay. So it could happen in three positions. Okay, it could have three sites, we can say. These ulcers can cause a burning or gnawing pain. Okay, burning sensation could be there in these ulcers, or gnawing pain. What is a gnawing pain? When someone bites or chew any of the part of your skin, the pain you feel at that time, that is called as gnawing pain. Pain in the upper abdomen. Okay, upper abdomen region. Peptic ulcer are the common medical condition that can range from small or shallow sores. Okay, if small, it can be converted from the small sores to the deep and larger sores. Okay, big and, like, first it could be small or not so deep. Other further it could be like deeper as well as big sore. What are the causes, common causes for peptic ulcers? These are the primarily caused by the imbalance between the stomach's acid production. How much acid is produced by, which acid is produced by the stomach? Can anyone tell? I told this before
HCl.
also.
HCl.
Yes, hydrochloric acid, HCl. So, by an imbalance between the stomach acid production, how much acid produced by the stomach, and the protective factor that line the stomach and small intestine. The primary factor that contributes to the development of peptic ulcer includes, that we'll see ahead. For first, we'll understand this. Okay, this layer,
Sorry,
this
sorry.
para.
Slow. Sorry, ma'am. Slow, please.
Okay. So what happens when this stomach acid production, this is the imbalance between how much production of the acid is done by stomach and the protective factor that line the stomach. Okay, so protective factor are becoming less. We'll see how in this diagram at last of this slide. Okay, so other, it is said that the primary factor that contributes to development of these peptic ulcers would be, first one is helicobacter pylori. In which disease we have studied about this? H pylori.
Gaster.
Gastritis.
Gastritis and indigestion also.
Yes. Okay, so here also, I told you na, that in abdominal problems it is usually H. pylori is affecting. So in this one also H. pylori is affecting infection. What happens in this? This bacterium can infect the stomach lining, and weaken the protective mucosal layer. Okay, it will weaken that protective mucosal layer by destroying it. Okay, make the lining more susceptible to damage from the stomach acid. So what is exactly happening? Just see in the diagram, and then you will read all this and you will understand this. What happens? This is our stomach. There is production of acid from the stomach. Which acid this is?
HCl.
Yes, HCl is produced by the stomach, and inside, matlab inner layer of our stomach is a mucosal layer. Okay, if it is there is imbalance between this production of the acid and the availability of this mucosal layer. Okay, when there is imbalance in these two, it can lead to the problem. So first factor which is affecting is H. pylori. So we'll see here. What is this? This is this here, you see, you can see this is our epithelial cell. Epithelial cells means uppermost skin, you can say like this. Okay, any organ or anything, skin you can say. So this is our stomach. And this is our mucus layer, which means mucosal layer is this. Now H. pylori damages the protective mucus. This is H. pylori bacterium. It is affecting our mucosal layer. Okay, and damaging it. As it is damaging it, it will destroy, and here you can see the mucosal layer is becoming very thin. Okay, by its destruction. So mucosal layer is becoming very thin, and this H. pylori is increasing day by day. So what will happen? Easily the acid passes through the weakened mucus layer. Now as mucus layer is weakened, so acid will be easily passed through it, and will damage our this skin part. Okay, and can cause sores or lesion in this. Okay, causing an ulcer, which can further leads to ulcer. So hopefully
Ma'am, can
very
you
much clear with this.
explain? No,
Yes, ma'am.
ma'am, can you explain again?
This diagram.
Yeah,
Okay, one
the
second.
whole slide, ma'am.
Huh?
Whole slide.
So whatever this here it is written, This same will I will explain the diagram. So if you will understand the diagram, you will be able to understand what is written here. Okay. So as I told you, this what is the cause? If there is imbalance between what how much amount of the acid produced by the stomach, okay, and imbalance between the production and the protective factors. Protective factor here means mucosal layer or mucus, okay. So imbalance between how much mucus layer is there and how much production of acid is there. If more production of acid is there and less protective factors are there, then it can lead to the problem. Okay. The most primary factors told are there are three factors in second slide. Other slide, two factors are also there. First most factor is Helicobacter pylori. Okay, what this Helicobacter pylori is doing? So this is our, now come to the diagram. This is our skin. Okay, this part epithelial cells. This is the epithelial is uppermost layer. This is our skin, epithelial tissues. These are connective tissues and like that. So now what is happening? This is inner mucosal layer. This blue part is inner mucosal layer of our stomach. So what happens due to this Helicobacter pylori? This start coming. Okay, first one Helicobacter pylori is there, then further get indulged into the many. Okay, so it starts damaging this mucosal layer. This blue color mucosal layer is start damaged by this pylori. Okay, so as the amount of the pylori will increase, it will start damaging more and more. So the time will come when this mucosal layer is such a thin that easily acid in the stomach can pass or weaken our this weaken mucosal layer. Okay, this thin mucosal layer is remained, so easily the acid will pass through it, which will further make.
Ma'am, your voice is
Yes, ma'am.
breaking. Your voice is breaking.
Voice is
Yeah.
Yes, yes, ma'am. Now it's only breaking.
now also.
Yeah,
Ma'am, can
ma'am. Now.
you speak for long?
What?
Can you speak for a long? Then I'll tell you again.
Yes, I'm saying that when there is thin, this mucosal layer become thin. So our acid easily passes through this layer and will cause damage to our skin. As it causes damage to our skin, in this, as a result of it, it causes sometimes sores or lesions, which is called as ulcer itself, and we can say it as a peptic ulcer. Is it now clear to all with this diagram?
Yes, ma'am.
Okay.
Yes,
So
yes,
it is
ma'am.
affecting the skin and like the visceral organs of skin of the visceral organs, right, ma'am?
Yes, here we are talking about stomach because peptic ulcers happens in stomach. Okay.
Yeah, yeah. Okay.
Okay. So now second, as we see H. pylori, second one is non-steroidal anti-inflammatory drugs. These are also harmful for us. Okay. Anti-inflammatory drugs, then when we used to take, we used to call it as NSAIDs. Okay. So prolonged use of NSAIDs such as ibuprofen. What happens? This is the one of the medication name. And aspirin. This is also an NSAIDs. Okay, can irritate the mucosal layer and will further cause damage to that layer, increasing the risk of ulcers. Okay, it will increase the risk of ulcers on damaging these layers. Excessive stomach acid production, this is very clear, as we have seen before only. If certain conditions can lead to, due to any of the condition or any of the reason, if excessive acid is produced, it can lead to overproduction of this stomach acid and increase risk of again ulcer, because you know the property of acid, it burns. Okay, immediately. So if excessive, it is required for our body. I told you before also, very much required HCl. Without that, the proper digestion will not happen. But if excessive, it will happen. It can lead to the ulcers or damage in the mucosal layer. Okay, these are told. SIDs and H. pylori could be the causes for acid peptic disease. So risk factors, there are certain risk factors: hereditary, smoking, and blood group O, other diet, alcohol, etc. Not required such much. Now types. This is important again. So what we'll see a little problem in the diagram. I will tell you. The two most common type of the peptic ulcers are most common are gastric ulcer and duodenal ulcer. Usually happen, could happen. But one more is there, esophageal ulcer that we'll also see. So what happened? Gastric, by the name itself, gas is there, something related to stomach. Okay, something related to stomach. So ulcers form in the lining of the stomach. Very simple. And then duodenal ulcer, by the name itself, which part is duodenal?
Small intestine, ma'am.
Which part? The small intestine is divided into
First one. First part.
First part.
Three,
First.
ma'am.
the small intestine is divided into.
Three.
Three
Three
parts,
parts.
and this is the first.
Okay, can you name all the three parts? I also gave that short form.
Duodenum, jejunum,
Ileum.
and
Ileum.
ileum. Yeah.
DJ, I told you na DJ.
DJI. Yes.
Yes. Okay. So I am DJ. Okay. So now gastric. Now you can in the diagram you can see. Don't see the numbering and don't match with this. First, see go. Will change pen. 1 second. So in the stomach it is happening. This will be called as. This will be called as. Can you repeat?
Sorry, ma'am.
Sorry, ma'am.
As it is inside, as this one which I am I'm using pen on. This is inside the stomach. Okay, this is our stomach. This is structure of stomach. This is inside the stomach, so it will be called as.
Gastric only.
Gastric ulcer, ma'am.
Yes. Okay, just don't go with the diagram. Just what I am asking, just focus on that. Now upper part of stomach. Now, can anyone tell how many sphincters are there in the stomach and name them?
Ma'am, two.
Ma'am, two
Two.
sphincters, sir. One is cardiac sphincter, or another one is pyretic sphincter.
Is it pyrotic?
Pyloric.
Yes.
Pyloric, yes, yes. Pyloric.
Okay, so this one is your pyloric sphincter. This one is your cardiac sphincter. So what happens? This is joined to which pipe?
Esophagus.
Yes.
Esophagus.
And this is joined to
Small
Duodenum.
intestine.
duodenum. Okay, is small intestine, upper part of the small intestine, that is duodenum. So in esophagus, if ulcer will happen, this region is ulcer. So what it will be called as?
Esophagus.
Esophageal.
Esophageal.
Esophagus.
Esophageal ulcer. And if it will ulcer will be inside this half part of the duodenum, then it will be called as.
Duodenal ulcer.
Duodenal ulcer.
Yes. Okay. You yourself can identify it. Actually, there is in this diagram, there is number like problem is there. Like in first, it is correct. Okay, duodenal ulcer is there. Second, it should be esophageal ulcer, but it is written gastric ulcer. And in third, it should be gastric ulcer, and it is written esophageal. So don't focus on this. Whosoever is attending the class, they will know this thing. Okay. So therefore.
Ma'am, so we need to say two only or three?
Actually, three are there, but usually people use these are cost. Okay, usually cost. But if I'll see ask for how many times, so we'll say three. Okay, most common. It is written na two most commonly caused maybe. Okay, so in the diagram you can see for identification. I wrote here also. Okay, gastric ulcer picture is third one. Okay, this is third one gastric ulcer, and in duodenal ulcer I have kept the first one. Okay, first one. Then of course it will be esophageal will be last second this one. Okay, is it clear to all? Any
Yes,
problem in the
ma'am.
diagram?
Yes, ma'am.
No, ma'am.
Okay.
Yeah.
Symptoms of duodenal ulcer is that lower one. So burning, epigastric pain. What is epigastric? Can anyone tell?
Ma'am, epi is related to internal or something?
What is epigastric?
AP we can consider means primary layer of stomach getting inflammation.
How many stomach is divided into how many parts? You all have gone through all the anatomy physiology. No?
Three parts, ma'am.
Three, ma'am.
Three parts.
Yes, ma'am.
You didn't study about this? It is divided into 9 parts like this.
Okay, okay, ma'am.
Yes.
Yes, means side too also. Okay,
So which part is called as epigastric part?
ma'am. Can you say fundus?
What?
Not sure.
This is 1, 2, 3. Name number them, okay? Which one is epigastric part? Fast, fast, fast.
Ma'am, AP means fast will be answer.
That
Means
I
what?
that I don't know. But just directly tell me epigastric. First and second I don't know.
Sorry, ma'am, I didn't know.
Please someone tell. Beautiful diagram I made.
I really can't remember अभी. And even I'm not able to recall कि मैंने पढ़ा भी है कि नहीं.
Actually, ma'am, I know only when I was studying in anatomy. At that time, means I know three parts, but now you are telling means nine parts. Then I am getting a little bit remembering means in two sides of stomach also divided by six parts, and then middle side also divided into three parts. Then three into the three nine part, but not exactly remembering that names, ma'am.
Okay, this one, second one is epigastric part. Okay, epigastrium reason we used to call it. And now you can today go and see all these. Okay, I'm just naming like once. This is left hypochondrium. Then this is a left lateral region because lateral is middle lateral part. So left lateral region. This is left inguinal because it is a little waist region. Okay, left inguinal region. This is right inguinal region. This is right lateral region. Okay, same. Okay, this is umbilical region. This main fifth one is middle one is umbilical region, and this one is right hypochondrium. Okay, these three are same. Here three and here three, all these are same. But a little right and left difference is right and left. This one is epigastric. You have to learn this, and middle one is umbilical region, and lower one is suprapubic region. With the name itself, pubic region, it will come. So suprapubic region used to
मैम
call it.
आई थिंक वो नहीं पढ़ा है हमने.
Okay, so no problem. Just to tell you that this upper part, this middle upper part of your stomach, just above the navel, is called as epigastric region. Okay, some people used to have their pain below the chest, above the proper exact abdomen, or above the navel, below the chest. Is the exact position you can understand like that. So burning epigastric pain, that's why I told you. 90 minutes to 3 hours after the meal, it could happen. Okay, weight gain. Now gastric ulcer symptoms are written. You can see by this burning epigastric pain made worsened by the food. Anorexia, this is food disorders. And then indigestion aggravates pain or food aversion. In anorexia also they have food aversion. This is eating disorder. You can see this deeply. Now weight loss could happen in gastric ulcers. No need to learn all these symptoms and all, but just to have a look on this. Complications, gastrointestinal bleeding could happen because lesions are happening now. Obstructions, penetrating cause acute pancreatitis. What this could be mean? Okay, without telling you, you can understand this. What this means?
Inflammation in pancreas.
Yes,
Yes, ma'am.
pancreatitis. Okay, inflammation in pancreas. Itis word means for inflammation. Pancreat word is for pancreas. Now cancer will be also reason. Diagnosis are done by endoscopy, barium X-ray, stool test, in which we used to say that whether H. pylori is there. Then this is serological test, H. pylori. Lifestyle management, food rich with fruits, vegetables, especially vitamin A and C. Bland food, that is blended food. Okay, food rich in the probiotics. What is probiotic? It is a live bacteria, like yeast also is one bacteria. What is the bacteria which is present inside the curd?
Lacto
Lactobacillus.
something. Yeah.
Okay. When otherwise, Sakshi ma'am is telling lacto only.
No, ma'am. Actually, I
Mean
forgot
lacto.
lacto vesicles or vesicles. It just got me
Okay.
confused.
Avoid spicy food, coffee, tea, milk because it all hurts or these are irritating. Okay, that skin layers. Stop smoking alcohol, reduces stress. Again, yogic management asanas, simple relaxing asanas, Pawanmuktasan, Shashankasan, Uttan Padasan, Bhujangasan, Shalabhasan, Sarvangasan, all this. And 1 to 2 weeks of this Surya Namaskar also you can go for. Pranayam, Brahmari, Nadi Shodhan, etc. Kapalbhat, in this Kapalbhati and all, in Kriya also Kapalbhati and all are not given because it may be hurting or maybe painful. Neti, Lagu Pangshan Pakshalan, Vaman Dhoti is done. Vaman Dhoti is that vomit out the milk and all. Sorry, vomit out that water and all. So, in bleeding ulcers, if ulcers are bleeding or causing bleed in as a symptom, then we should avoid Vaman Dhoti in that case. Okay. So, with this, thank you so much. We have completed with peptic
And
ulcer. Yes, ma'am.
one question came into my mind when you asked about lactobacillus. Lactose is present in milk, right?
Yes.
So when it got converted into curd, it become lactobacillus, right?
Actually, that is not converted. There is a development of as its properties state changing. So there is development of lactobacillus, uh, this bacteria. Okay,
Okay,
not like
okay,
that.
okay.
Okay, that only converted into that. Okay, this is the
Yeah,
as
yeah.
properties are changing. So
Property
converted
changed.
into.
Okay, ma'am. Thank you, ma'am.
So for this one example I can give. We used to make khichdi with the rice itself, now. So still, like still we can't say it as same. So properties are
Yeah,
changed. That's it. Okay.
yeah, ma'am.
So like this, we have completed this. Now, shall I ask questions for 5 minutes or not?
Sure, ma'am.
Okay. So who will tell what is? 1 second. Just wait for 1 second. So we'll tell what is the meaning of. What is the meaning of diabetes mellitus? Okay, Shravani ma'am will tell what is diabetes mellitus.
Excessive sugar, ma'am. Diabetes is a fountain of sweet.
What is which organ is involved in diabetes? Lipalika ma'am.
Pancreas.
Okay. How many cells are there in the pancreas, which we have studied? Sakshi ma'am.
Alpha, beta, delta.
What does delta produce, Shravani ma'am?
Somatostatin.
Okay. And what does alpha produce, Nepalika ma'am?
Glucagon.
And beta cell, Sakshi.
Insulin.
Okay. What is the function of insulin, Shravani ma'am?
It works like a receptor, ma'am, to store the receptor to store the glucose in the cell. In the cell.
receptor. Repeat. Can you repeat?
Insulin, it works like a receptor to store the glucose in the cell. So it a balance like it will reduce the sugar level in the blood.
Mix. What she is saying, is it correct, Sakshi ma'am, or any changes you want to make in what she told? Okay, not by yourself.
I think she's right, ma'am.
Okay, so insulin is receptor.
No, ma'am.
Works as a
Insulin.
receptor, ma'am.
Okay. But okay. So you should tell like that it is sending glucose to the cells. Actual work is that only, and also storing in the form of in the liver also. What is the
Black.
work of? Yes, ma'am. Yes, Lipalika ma'am. What are you saying?
Yes, ma'am. You're saying means insulin help to reduce the sugar level in the blood and it's stored in the liver in the form of glycogen.
In first one stored in the like first of all sent to the cells and as much
Yes.
required. If when there is excess still, then store in the form of the glycogen in the liver. Okay. These are the functions actually, Shravani ma'am. Okay, just remember these. Now, other, what is the function of what is the fourth cell we have studied produced? Sorry, fourth hormone produced in the pancreas. Okay, tell Shravani ma'am.
Hunger hormone, ma'am. Ghrelin, ghrelin,
What is the other name of? Yes, ghrelin.
ghrelin.
Okay, very good. So now, how many types of diabetes are there? Okay. First, Sakshi ma'am will tell.
Ma'am, type 1 diabetes. I mean,
Yes, tell.
four types of diabetes. I'm sorry. Four type of diabetes. Type 1, autoimmune disease. Ma'am, do I have to explain it?
Four types of diabetes is there.
Okay. Yeah, like type 1, type 2 diabetes and gestational diabetes.
Type 1, type 2, and gestational diabetes. Still
And
four.
pre-diabetes also.
Okay.
Pre-diabetes.
Pre-diabetes
Oh,
is not be involved in this. Okay, that is not come under diabetes. Okay, why are you taking them pre-diabetic to diabetes?
okay, I'm sorry, ma'am.
Okay, so three we'll say. Say usually two, but still this is also involved three. So what is a gestational diabetes, Shravani ma'am?
So diabetes happened during pregnancy time, ma'am.
Okay, what is what are the tests used for diabetes, Lipalika ma'am?
PBC and BFC and random.
Full name? Can you name?
Fasting blood sugar, then pra, pran, prandramial. What is that word? I am always confusing that word.
Prana? How many
That
tests are there for diabetes?
three test, ma'am. First before fasting, then after taking food, then random.
Can anyone name, Sakshi ma'am? You can name them.
Ma'am, postprandial blood sugar, random blood sugar, fasting blood sugar.
Post prandial, we used to call it. Okay.
Okay, ma'am. Prandial.
So, what is type 1 diabetes, Shravani ma'am?
Insulin dependent diabetes, ma'am, where there will be like less not even less. Insulin won't produce in the body. It will happen mostly in the childhood only.
Hmm. The other name of type 1 diabetes, Sakshi ma'am?
And autoimmune disease. Juvenile
Oh,
diabetes. Sorry.
whole
Juvenile
diabetes is
diabetes.
yes, juvenile
Juvenile.
diabetes. The juvenile word is for child or small students. Okay, now Lipalika ma'am, what is type 2 diabetes?
Ma'am, type 2 diabetes when insulin production is there, but our cell receptor is not working, means not accepting that insulin. That is the type 2 diabetes. And
So
that receptor glut 4.
what problem? Okay, ma'am. What problem happens that it is not accepting, Sakshi ma'am?
In type, just a second, ma'am.
Two.
Type 2. Okay. Uh,
You are saying in the copy.
no, no,
It's
no, ma'am. Actually, I was in a room and there was too much noise, so that's
okay, okay.
okay. Type 2 diabetes. Sorry, ma'am. What did you ask? Can you please ask again?
In type 2 diabetes, what happens? First of all, tell.
Here, insulin get produced, but body is not taking insulin. I mean, cell
Why?
is not accepting the insulin.
Why? What happens that cell is not accepting?
Actually, not cell. I think. Okay, wait.
What do you think?
High, too much of blood sugar level in the, too much of sugar in the blood. Oh,
Shravani ma'am, will you do? You will
reduce
tell?
stomach.
Ma'am, glucose cannot enter into the cell, and even glucose cannot store, so the sugar level will be increased in the blood.
So why it is not entering into the cell?
Insulin resistance, ma'am.
Insulin resistance is happening due
Yeah,
to
yeah, ma'am. Cell become insulin resistance. Sorry, ma'am. भूल गया था.
it is happening due to this insulin resistance is also happening due to
क्योंकि cell नहीं accept कर रहे. Cells
Lipalika
become
ma'am, you
insulin
will tell.
resistant.
Is not, ma'am, cell receptor was not working. That's why
Yes, sir. What cell receptor? It is not cell receptor. It is insulin receptor because it is recepting insulin. What
yes.
is the name of insulin receptor, Shravani ma'am?
Glut 4, ma'am. Glut 4.
Yes. Why you are all that is insulin? Say the reason for not entering into the cell. So first point, the cell taking through this only. So due to the damage or problem at the level of receptor, insulin receptor named as
Ma'am,
glucose. Yes, ma'am.
what did you mention for that word for insulin receptor?
It is
Abhi,
named as GLUT4.
GLUT4. It's
And
a
I told
insulin receptor.
it's the insulin receptor because it is recepting insulin.
It is not letting insulin go into the blood, go into the cell.
Insulin. What is the
Yeah.
work of insulin? It will not let insulin take glucose into that. Okay. It is not letting like this GLUT4 damage or at the level of this GLUT4 is happening. So though lot of glucose is present inside our body and lot of insulin is also there, and work of insulin is to send the glucose into the cells. Though lot of insulin is there, a lot of glucose is there, still our cells are starving for glucose. Okay, so this receptor are taking glucose inside with the help of insulin. So if insulin will knock there, okay, knock, who will let insulin to go inside? The relatives of insulin itself, na. Therefore it is called as insulin receptor, but it is letting insulin to bind with that. Insulin will bind this GLUT4 receptor and further it will get open, the pathway or gate will be opened so that glucose will enter inside the cell. This is how it works. If insulin is not, if lots of insulin is there, lots of glucose is there, still our cell is starving, that type of diabetes is called as type 2 diabetes. Insulin resistance is there. Okay, okay, what is the reason for insulin resistance? Is that damage of this glut4. Okay, Is it now clear?
Okay, ma'am. Yeah.
Sakshi
I'm
ma'am,
got
is it clear?
confused. Ma'am, I got confused. I have to go to the recordings again.
No, I will make you understand here only. No need to, like, you can go through these recordings also. But one thing, one second, just wait. So I will present screen and once show you this. So see, my screen is visible to you. I will show with the diagram, okay? And this will be the last topic, है ना? So what happens in type 2 diabetes? This is our blood streams, okay? In which glucose is there, lots of glucose is there, okay. Insulin is also there because in type 1 diabetes, juvenile diabetes, which happens usually in the children's, no insulin is there. As insulin is not there, so therefore what happening in that, in type 1 diabetes, no insulin is there inside these like inside like due to the damage of beta cells inside the pancreas, insulin is not produced. As insulin is not there, there is no one, like zomatos are and all are there na, they are the traveling partners, okay. So no one is there to take this glucose inside the cells, okay, likewise here. So due to which what is happening, so as glucose is not going inside the cell, so again the high level of glucose in the bloodstreams, and this high level of glucose means high sugar level, therefore we used to call it as a diabetes. This is type 1 diabetes. What happens in type 2 diabetes, there is lot of glucose inside the bloodstreams, okay, there is insulin also present, okay. So what is the work of insulin? It will send this glucose into the this what is work, this will send this glucose into the blood cells, okay. Blood cells, this is blood cells. Our blood cells will have some receptors. What is this receptor? This receptor is known as what is the name of the receptor? GLUT4, okay. So this GLUT4 is insulin receptor. Why? Because now insulin will come and just bind exactly with this and send this glucose inside this our body cells, okay. And this glucose is nothing but carbohydrate converted into glucose, which will be further used as energy, or whatever the work we are using, we are speaking now, everything is done by that glucose, okay. So in type 2 diabetes, insulin is there, lots of glucose is also there. So insulin should send this glucose into the cells, okay. Insulin is trying to send this glucose, this is going also up till this gate. Now insulin is knocking on the gate, which gate? GLUT4. But this receptor problem at the level of receptor, due to certain immune responses or anything like that, T cell responses, etc. So this receptor is not accepting insulin. As it is not accepting insulin, how it will go inside the how it will go inside the home or the cell? So this is how, as insulin is not binding, not able to bind with this receptor, so this is how it is not able to send glucose inside the cells. So therefore it is said, lots of glucose is there, lots of insulin is there in type 2 diabetes, still person cells are starving for energy or starving for glucose, okay. This is type 2 diabetes. Therefore sometimes happen in this diabetes, people become lean, okay. वो पतले हो जाते हैं बहुत ज्यादा, their body get squeeze off like that. Is it clear to now you, Sakshi ma'am, now?
Yes, ma'am. Yes, ma'am. Sorry,
Okay,
ma'am,
so
for the trouble.
for everyone it is clear now. very
Yes, ma'am.
easily very easily you can understand that as someone comes at our home, any relative comes at home, they used to take some fruits with them. Similarly, insulin is coming to our home or cells, our body cells, taking glucose as a fruits, okay. Still, as some people, someone else is there at our home, so he is not opening gate for that insulin, so it will not able to take that glucose inside the body. In such a condition, our cells are starving for the glucose, though lots of glucose is present inside the body along with the insulin, okay. Now it should be very much clear. that you will not forget the whole lifetime. Is it okay?
Yes, ma'am. Yes, ma'am.
Okay, very good.
Sorry, ma'am, for the trouble.
No problem. Okay, so with this, now we'll end the session. If any doubts, you can ask. Otherwise, we'll meet tomorrow, hopefully. Maybe no, also. And could be it could be possible that tomorrow will be the last class. Then afterwards, we'll take one week gap. And whenever I will start, I'll message you. Okay.
Okay, ma'am.
Okay. So thank you so much to everyone.